As a doctor, I want to sound an alarm, a serious warning that needs your immediate attention. It's about a health issue that's far more prevalent and potentially dangerous than many realize. We often underestimate the subtle signs our bodies send us, and this is one area where ignoring those signals can have devastating consequences. About a condition many people dismiss: acid reflux. It's that familiar burning sensation, that discomfort after a meal, that sour taste that creeps up your throat. While it might seem like just heartburn, a minor inconvenience that can be easily managed with over-the-counter medications, it can signal a much more serious, hidden cancer risk. A risk that silently develops over time, often masked by seemingly harmless symptoms. Chronic untreated acid reflux, the kind that occurs frequently and persists for months or even years, is driving a rise in esophageal cancers, a type of cancer that affects the tube connecting your mouth to your stomach, often going unnoticed until it's too late. The insidious nature of this progression is what makes it so dangerous. The symptoms can be subtle or even absent, especially in the early stages, creating a dangerous gap in awareness. This lack of clear warning signs allows the damage to accumulate, increasing the risk of cellular changes that can lead to cancer. That persistent cough, the one you can't seem to shake, sore throat, that scratchy feeling that lingers, or voice change, a subtle hoarseness that you might attribute to a cold. They could be signs of acid reflux, the silent culprit behind more than just digestive discomfort, damaging your esophagus. The constant exposure to stomach acid can erode the delicate lining, leading to inflammation and cellular changes. Many people blame these on allergies or aging, dismissing them as normal parts of life, but they're classic warning signals. Signals that your body is trying to tell you something important. We need to stop thinking of acid reflux as just indigestion, a temporary inconvenience to be treated with a quick fix, and recognize its life-threatening potential. It's time to take this condition seriously and understand the long-term risks associated with ignoring it. The journey from reflux to cancer is preventable, with early detection and appropriate management. But only if you're aware. Awareness is the first and most crucial step in protecting yourself. Listen to your body, pay attention to those subtle cues, those nagging symptoms that you might otherwise dismiss, and seek medical advice, even for minor symptoms. Don't hesitate to consult with your doctor if you experience persistent heartburn, a chronic cough, or any changes in your voice. In the next sections, we'll explore what acid reflux is, delving into the underlying mechanisms and causes, how it leads to cancer, examining the specific cellular changes that occur, and how you can protect yourself. We'll discuss lifestyle modifications, dietary changes, and medical interventions that can help prevent this progression. Your health could depend on it. Taking proactive steps today can significantly reduce your risk and ensure a healthier future. Millions of people are walking around with acid reflux, and the truly alarming part is that they don't even know it. They might be experiencing subtle symptoms, attributing them to other causes, completely unaware of the underlying issue silently affecting their health. It's a widespread problem that often goes undiagnosed. Normally, a specialized valve, known as the lower esophageal sphincter, acts as a gatekeeper, diligently keeping stomach acid where it belongs, safely contained within the stomach. This valve is designed to open and close, allowing food to pass through while preventing the backflow of corrosive stomach contents. However, when this crucial valve weakens or malfunctions, it can lead to a situation where stomach acid splashes up, escaping its designated area and irritating the delicate lining of your esophagus. This backflow is what we commonly refer to as acid reflux. What makes this condition particularly insidious is that many people never experience the classic telltale sign of heartburn. They might feel completely fine or attribute their discomfort to something else entirely. This less obvious form of acid reflux is often referred to as silent reflux, also known as laryngopharyngeal reflux, or simply LPR. In cases of silent reflux, the stomach acid can travel much further, reaching your throat and even your sensitive voice box. This can occur without causing the typical chest pain associated with heartburn, which means the symptoms are often overlooked or misdiagnosed. People may not realize that their throat irritation or voice changes are actually related to stomach acid. One common sign is that you might wake up with a hoarse voice, especially in the morning. You might also find yourself constantly clearing your throat, a persistent tickle or irritation that you mistakenly attribute to allergies or the dry air in your home. Silent reflux is like a slow, insidious water leak in your plumbing. The damage builds up quietly and gradually over the years, often without any obvious warning signs until the problem becomes more severe. Studies have shown that up to half of those with significant acid damage in their esophagus or throat never actually experience the sensation of heartburn. So, for every person who is clearly suffering from the burning chest pain and discomfort of obvious acid reflux, there's another individual silently experiencing ongoing harm, completely unaware of the damage being inflicted on their body. This widespread lack of awareness makes silent reflux a massive public health issue, one that is essentially hiding in plain sight, affecting countless individuals without their knowledge. Recognizing that acid reflux doesn't always manifest in the form of obvious heartburn is the crucial first step towards protecting your long-term health and well-being. Don't wait for the onset of debilitating pain. Be alert and proactive in recognizing the subtle signs and symptoms that could indicate the presence of silent reflux. Early detection is key to preventing further damage and maintaining a healthy digestive system. Chronic acid reflux can trigger a dangerous chain reaction in your esophagus. Repeated acid exposure causes inflammation, called esophagitis. Over time, your body may replace normal cells with acid-resistant ones, a condition called Barrett's esophagus, a major warning sign. Barrett's isn't cancer, but it raises your risk of esophageal cancer by up to 40 times. The real danger? Barrett's often has no symptoms beyond reflux, which itself may be silent. If unchecked, abnormal cells can become cancerous and spread quickly. Esophageal cancer is hard to treat and has a low survival rate, especially if caught late. Early detection, ideally at the Barrett stage, can save lives. Heartburn is just the tip of the iceberg. Chronic cough, constant throat clearing, morning hoarseness, or a sore throat can all be signs of silent reflux. Acid can inflame your voice box and throat, causing a lump sensation or extra mucus. Breathing problems, like adult-onset asthma or unexplained wheezing, may also be linked to reflux. Even your dentist might spot acid damage. Stomach acid erodes tooth enamel, especially on back molars. These symptoms are often dismissed, but they're your body's warning signals. If you have persistent cough, throat, or breathing issues, consider acid reflux as a possible cause. Don't ignore these clues. They could be life-saving. Your doctor and dentist are key to catching acid reflux early. Doctors look for patterns. Chronic cough, hoarseness, or unexplained throat symptoms may prompt questions about your digestion. Dentists can spot enamel erosion from acid, often before you notice symptoms. If acid reflux is suspected, your doctor may recommend an upper endoscopy, a camera test to check for damage or Barrett's esophagus. This simple procedure can catch problems early, sometimes before you feel anything. If Barrett's is found, you'll be monitored regularly to prevent cancer from developing. Early detection turns a deadly risk into a manageable condition. Don't wait for severe symptoms. Let your healthcare team help you stay ahead. Prevention starts with awareness and action. It's easy to ignore minor symptoms, but with silent acid reflux, that can be dangerous. Persistent throat clearing, hoarseness, or cough may be your only warning signs. Seeing your doctor is a simple, proactive step that could protect your long-term health. Be honest about all your symptoms, even if they seem unrelated. Your doctor may suggest a trial of acid-reducing medication or refer you to a specialist for further testing. Early diagnosis means more options and better outcomes. Don't let fear or inconvenience stop you from seeking help. A doctor's visit can provide answers, reassurance, or a treatment plan. The small effort of an appointment is worth the chance to prevent a devastating disease. Take your symptoms seriously, your future self will thank you. The numbers are sobering. Esophageal cancer is the 7th leading cause of cancer death in the UK. Each year, over 9,000 people are diagnosed, and around 8,000 die from the disease. The most common type, linked to acid reflux and Barrett's esophagus, is rising rapidly. Obesity and chronic reflux are fueling this increase. Awareness is dangerously low. Most people don't connect heartburn with cancer risk. Men over 50 with a history of reflux are at especially high risk. Most cases are diagnosed late, when survival rates are poor. Knowing your risk factors and acting early can make all the difference. Don't ignore persistent symptoms. Speak to your doctor. The good news? You can lower your risk with simple lifestyle changes. Quitting smoking is one of the most powerful steps. Smoke weakens the valve that keeps acid down. Losing even a small amount of weight reduces pressure on your stomach and cuts reflux episodes. Identify and avoid trigger foods. Fatty and spicy foods, chocolate and caffeine, and acidic foods are common culprits. Eat smaller, more frequent meals and avoid eating 2 to 3 hours before bed. Elevate the head of your bed to prevent nighttime reflux. If lifestyle changes aren't enough, medications like antacids or proton pump inhibitors can help. In severe cases, surgery may be an option. Work with your doctor to find the right plan for you. Small changes can have a big impact on your esophageal health. Prevention is in your hands. Don't underestimate acid reflux. It's more than just a fleeting discomfort after a heavy meal. It's a persistent issue that can have serious long-term consequences if left unaddressed. Many people dismiss it, reaching for a quick over-the-counter fix. But ignoring the underlying cause can be a dangerous gamble. It can be the first, seemingly innocuous step toward a deadly cancer, specifically esophageal cancer. The link between chronic acid reflux and this particular cancer is well documented, and it's a connection we need to take seriously. Knowledge is your best defense, your shield against potential harm. Understanding the risks associated with untreated acid reflux empowers you to make informed decisions about your health and seek timely medical advice. Share this information with loved ones, spread the word, start conversations. The more people who are aware of the risks, the more lives we can potentially save. Early detection is key, and awareness is the first step. You could save a life simply by sharing what you've learned. It's a small act that can have a profound impact, offering someone the chance to seek help before it's too late. The path from reflux to cancer takes years, often decades, a slow and insidious progression. This isn't an overnight transformation. It's a gradual process that unfolds over time, giving us time to act, time to intervene, time to change the course of the disease. This extended time frame is our greatest advantage, allowing for early detection and effective treatment. If you have persistent symptoms, if you find yourself constantly battling discomfort, heartburn, a nagging cough that won't go away, sore throat, persistent hoarseness that alters your voice, or trouble swallowing, a sensation that food is getting stuck, see your doctor. Don't delay, don't hesitate. Don't self-diagnose, relying on internet searches and anecdotal evidence, or rely on over-the-counter remedies alone, masking the symptoms without addressing the root cause. A proper evaluation, conducted by a medical professional, can reveal what's really happening beneath the surface and open the door to prevention, offering a pathway to proactive healthcare. Discovering Barrett's esophagus, a condition linked to chronic reflux, is not a cancer diagnosis. It's not a sentence. It's a chance to stop cancer before it starts, a window of opportunity to take control of your health. Regular monitoring and treatment, guided by your doctor, can halt the disease in its tracks, preventing further progression. But we can only help those who come forward, those who take the initiative to seek medical attention. Take your symptoms seriously and schedule that appointment. It's the most important step you can take. Your health is your most valuable asset. Cherish it, nurture it, invest in it, protect it, safeguard it, prioritize it above all else. Together, united in our awareness and proactive approach, we can turn the tide on esophageal cancer, reducing its impact on our communities. With awareness and action,